Opioid use in pregnancy, addressing the challenges and supporting maternal health. In this presentation, we will discuss opioids, pregnant women with opioid use disorder, how opioids can affect the fetus, and how healthcare professionals can help improve maternal and fetal health outcomes. As healthcare professionals, it's important to know how to help this vulnerable population. So what are opioids? Opioids come in various forms such as liquid, powder, or pills and can be smoked, snorted, vaped, or injected. Opioids can be natural or synthetic. They include both prescription medications and illicit drugs. Since 1999, the number of opioid deaths in the U.S. has increased. There have been 3 waves of increased opioid-related overdose deaths in the last 25 years, with each wave being driven by a different type of opioid. Approximately 224 people a day die from opioid overdoses. The first wave started in the 1990s when medical prescriptions for opioids began to increase. This was followed by an increase in the illicit opioid use. The second wave began in 2010 with an increase in heroin overdoses, and the third wave in 2013 with the emergence of illicit synthetic opioids. Opioid use disorder in pregnant women is on the rise, paralleling that of the general population. It is a pattern of opioid use characterized by tolerance, dependence, and an inability to control use despite negative consequences. It is a chronic but treatable disease. Programs which use opioid agonist therapies such as methadone, buprenorphine, and suboxone during pregnancy can significantly improve both maternal and infant outcomes. These medications are commonly prescribed and have been found safe to use in pregnancy. Some research studies support the use of buprenorphine over methadone due to the better infant outcomes. A study done by Wang et al. In 2023 noted infants who were treated with methadone versus buprenorphine had a higher risk for preterm birth, low birth weight, and increased NICU admissions. These medications are used to help manage cravings and withdrawal symptoms to prevent maternal overdoses and fetal deaths. In 2020, the Texas Maternal Mortality and Morbidity Review Committee found that 7% of pregnancy-related deaths in Texas were due to substance use disorder. Pregnant women using opioids have a 6-fold increase in maternal obstetric complications, such as preeclampsia, third trimester bleeding, postpartum complications, malpresentation, and fetal distress. Neonatal complications include narcotic withdrawal, postnatal growth deficiency, neurobehavioral problems, and an increase in neonatal mortality, including a 74-fold increase in sudden infant death syndrome. Neonatal absence syndrome or neonatal opioid withdrawal syndrome are often used to describe the withdrawal period among newborns during the first 28 days of life due to the long-term exposures to opioids before birth. It is important for these women to seek early prenatal care. A multidisciplinary team approach utilizing addiction medicine physicians, obstetricians, psychiatrists, nurses, and many others is important in helping these women and infants have successful outcomes. Inpatient treatment for a few weeks is generally needed in the beginning to start medication-assisted treatment with methadone or buprenorphine. Once they are stable on their medications, they can be managed generally on an outpatient basis. Some women, however, may stay in residential treatment facilities. These facilities sometimes allow their other children to stay with them throughout their pregnancy. At residential treatment facilities, they also can receive some counseling, medication-assisted treatment, and also peer support. Programs such as the Maternal Opioid Misuse Model, which is a new national pilot program from the Centers for Medicare and Medicaid Services, helps pregnant women who have Medicaid get treatment for opioid use disorder during and after their pregnancy. Currently, this program is only available in the Houston area of Texas. Some other areas in the state have similar grant-funded programs. These programs all have multidisciplinary teams, each having an important role in helping these women. Pregnant women who use opioids face tremendous stigma and judgment when they seek prenatal care. They experience bias and judgment from healthcare workers. This can isolate these women and make it harder for them to seek prenatal care. Person-first language should be used by all healthcare workers when interacting with these women. In conclusion, ongoing multidisciplinary support is essential for these women to ensure positive health outcomes and long-term well-being. It takes a team of healthcare professionals who understand these women and are committed to walking with them each step of the way. Thank you for listening to my presentation today. Here's a list of my references if you would like them.